Good evening. David Love's my name. I'm a representative from the College of Surgeons in Victoria, and I'd like to welcome everyone to tonight's webinar on digital health, and also welcome our speaker, Cathy Rainbird from the Digital Health Agency. I'll start by the welcome to country, and we would like to acknowledge the traditional owners of country throughout Australia and recognise their continuing connection to land, waters and community. We pay our respects to them and their cultures, to elders both past and present. Now, I'll commence with a little bit of housekeeping. There will be a Q&A session at the end of the webinar, so if we can ask that participants type their questions during the presentation and we'll answer them toward the end of the session. So without further ado, I'd like to introduce our speaker, Cathy Rainbird, who's going to talk about digital health and the My Health Record platform. Cathy holds a PhD in behavioural science in relation to medicine and is a senior provider adoption lead at the Australian Digital Health Agency. She's based in Western Australia and has been working with Aboriginal medical services and other health providers, both in WA and nationally, training them in the benefits and the features and the clinical use of the My Health Record. So without further delay, I'd like to introduce Cathy, and I will hand over to her now.
Thanks so much, David. Just confirming that you can hear me.
I can hear you.
And that you can see my slides on slideshow.
Yes, we can.
Lovely. Thanks very much for that welcome. It's a pleasure to be here and to be presenting to you and your members. And I hope you all find the information this evening useful. In particular, highlighting some of the digital health tools that are available and that the Australian Digital Health Agency has been working to support across the country. In terms of an agenda, I'll give a brief update about electronic prescriptions that's been rolled out across the country now, and particularly pertinent for those places that are being impacted by COVID-19 lockdowns, meaning that you can just electronically send a prescription to your patients and then they can get that filled. That is designed to replace the image-based prescribing that's being utilised by some when they're doing telehealth consults. I'll then focus on My Health Record and in particular give you an overview of what it is and some of the latest statistics, and talk about some of the key information that is available in the system at the moment. And then we'll jump into a live demonstration, and David's hopefully going to be my devil's advocate, if you like, and challenge me to show him some of the information that he can find in the system and what would be useful for him as a surgeon. I'll talk briefly about security and patient controls and how they work, and point you towards some useful resources and how you can access and use it in your different systems in the hospitals versus private practice. And then we'll have time for questions. So moving straight on to electronic prescriptions. Firstly, I'd like to point out that electronic prescriptions are just an alternative to paper. So you don't need to use electronic prescriptions. You can still use paper prescriptions, but they are now a legal form of prescription that's been passed through Commonwealth and state and territory legislation at all levels. They're not mandatory, but you can choose to provide those to your patients if you wish. And as I said, they're particularly useful in the context of COVID. If you are doing a telehealth consult, you're trying to keep distance from the patient and keep them out of your practice potentially, you can literally just send an electronic script rather than having to print a paper form. And you can then don't need to send it through to the pharmacy as well. So it's just all done electronically. So in terms of a bit of a sort of evolution of prescriptions, if you like, over time, on this left-hand side here, you can see the old traditional paper script written, handwritten, and the concerns that can sometimes raise with not being able to read the handwriting in some instances, not saying anything about doctors' handwriting, but I'm sure you all understand, and how that's moved on now to the printed versions of paper scripts. So these two in the middle are still a paper script because they have to be printed out, handed to the patient in a paper form, but they are printed from your computer so that the actual script is much more legible, and so much easier for the reduction of errors in that prescription. The next step is the introduction of this barcode, which provides the pharmacy with the opportunity to scan that barcode. It's still not an electronic script, it's still a paper script, but that barcode provides some information, background details about the patient, so that then they can make sure they're giving the medication to the right person. And finally, we have what we have now, which is the electronic prescriptions, which comes in the form of a QR style token that gets sent to the patient's phone, which unlocks the prescription. The prescription is actually sent to what's called the prescription delivery service. It's stored in that delivery service until the pharmacy scans that QR code and then pulls down the prescription information from that delivery service. And that's a true electronic form. So in the case of a lockdown situation, the patient could have that QR code sent to their phone. They can then call the pharmacy, send them through that QR code, and the pharmacy can fill it and get it delivered. So there's no need for any face-to-face contact. There's a number of ways that electronic prescriptions can be managed. So the patient can receive the token on their mobile device as an SMS, or they can get it sent as an email. Alternatively, they can have a carer or agent who receives that SMS or token on behalf of the patient. There are a number of different mobile apps and ways to store tokens, which make it easier for patients who take multiple medications. But a new aspect of electronic prescriptions is that patients can also register for what's called an active script list. So that basically gives the pharmacist access to any active prescriptions that they have in their prescription delivery service store, if you like. So they don't even need to keep those tokens or have them on their phone. They can turn up to that pharmacy and say, can you please fill my script that's on this list for me? So it's all exciting and being rolled out particularly quickly to help address the COVID-19 situation. It was always in the plan for the agency, but has been fast-tracked as a result of COVID. Of course, the key benefit of electronic prescriptions for you as specialists is that it can, of course, help reduce risk of medication errors. We all know that they have a significant impact, not just on patients themselves, but across the whole healthcare system. It can improve efficiencies in workflow. It means less paperwork. You don't need to send off copies of paper prescriptions, and potentially reduce patient misuse of prescriptions. There's also no reduced duplication of prescriptions because you can see that what the patient's already had filled, and improved medicine compliance. So that's a very brief snapshot about electronic prescriptions, but the main focus for this evening is on My Health Record and how that can benefit you in your clinical practice and support better patient care for your patients. To start, for those of you who perhaps aren't familiar with what My Health Record is, I guess I'd just take it back to the real nutshell of what it's all about. And really, My Health Record is about having key healthcare information available wherever and whenever it's needed. So it doesn't replace your existing clinical records or replace your clinical systems that you currently use, but it complements those and provides a source or repository where that key information can be securely stored online so that any healthcare provider who's involved in that patient's care can access and see it. It is personally controlled in that an individual does get to choose, firstly, whether or not they have a My Health Record. The good news is that most people now have one, but they can also put specific controls over their My Health Record if they wish, if they have concerns about who can see it. I should always point out that it is really only accessible to the patient themselves. If they have a carer, they can nominate them to have access to it, and healthcare providers who are registered to use the system. So you can't just jump onto Google and look up someone's My Health Record. That's not how it works. And that's why there is quite a registration process if you are in private practice to make sure that you are in the position to have that registration and use the system. One of the key benefits of the system is that it is a national system, so it crosses both interstate boundaries, but also that public and private health divide. So that if you're working in the public hospital system, you can look at someone's My Health record and see information that has come through from the private sector and vice versa. The other beauty of it is that it is accessible at all times, provided you've got connection to the internet. So 24/7, if someone is wheeled into your hospital's emergency department and you're suddenly called to provide surgery for them, you can look up their My Health record and get a quick snapshot background overview of what's been going on for that patient without having to track down their GP, who may be closed and not available. It is protected, the system is protected in a number of ways. In particular, any software that is designed to talk to My Health record or to integrate with it has to go through a technical conformance process to meet the standards that are required and the security standards that are required. So you might find that some software doesn't yet conform to that system. So not all software does, but we're working with a lot of the software vendors and encouraging them to meet those standards so that then they can integrate and you can use My Health records directly through your software. Other protections in place include firewalls, security, encryption, and the data is all stored within Australia. So these stats are getting a little old now. We've got some updated stats on our website, but as of April 2021, you can see that over 22 million Australians have a My Health record. So that's a significant proportion of the population. So most people coming into your practice would already have a My Health record in existence. And the number of those records that now have information in them or data in them is significant. Initially, when a My Health record was initially created, they start off like a bit like an empty folder, and it's only as a person interacts with the healthcare system that the information then flows into that empty folder, if you like, and it builds up over time. But there's more and more people who have those folders now filling up with information and more information becoming available. I'll go into more detail about what's inside later in the presentation, but just to highlight that we already have over 2.81 billion documents in the system, including 135 million clinical documents. So that clinical significance and the usefulness for you as clinicians is really starting to grow and become apparent. And a lot of the hospital clinicians that I've been working with are saying it's now worth looking in at the My Health record. For a while, you know, you'd open one and not find very much. Now there is that significant amount of clinical content. There's also other information flowing into the system. You can see there's medicines information, consumers can upload information as well. I'll talk about that a bit later on. And there's also information that comes through from Medicare. So that can be quite useful, in particular in relation to immunisation status, if you're interested in looking at that. So the Digital Health Agency has been working closely with a range of key clinical peak bodies such as RACs, but also with primary health networks, PHNs across the country to get those connections in place. So a lot of work was initially focused on getting general practice and pharmacy connected, working with state jurisdictions to get public hospitals connected as well. So you can see here that we've really got a lot of those now registered and actively using the system and contributing information into the system. I should point out that we're also working with private hospitals, and we're now focusing on specialists and allied health professionals, as well as aged care and pathology and diagnostic imaging providers. So more and more clinical content is then available from those different healthcare provider organisations as well. In terms of how many documents or those clinical documents are already in the system, you can see here we already have over 101 million pathology reports and 13.5 million diagnostic imaging reports available in the system as of April. So that's a really significant, as I said, clinical content, and makes it more viable and worthwhile for you to think about having a look in a person's My Health record. And you might find something that you didn't directly receive that could be really useful. I should point out, in terms of pathology and diagnostic imaging reports, that is dependent on the lab or the service that's doing that imaging being connected and uploading their reports to the system. So if you look in My Health record and don't see a pathology report, it doesn't mean that the patient didn't have it done. It may be that that organisation or lab hasn't yet connected. But we do have a list of those that are connected on our website, and you can have a look at that and see if those that you regularly see patients from are connected and whether they're uploading their reports. So this is just to give you a bit of an overview of the types of documents that are available in the system. On the right-hand side of this screen, you can see the list of provider documents that are available. One to point out in particular is the Shared Health Summary. That is useful if you're seeing a patient where perhaps the referral that you've received is a bit sketchy on the details. A Shared Health Summary is a document that's uploaded by the person's regular GP, and it includes things like allergies, adverse reactions, current medications, past medical history and conditions, and some immunisations information. So that Shared Health Summary, if it's available, can be a really useful starting point to get a good overview of that person's health status at that particular point of time of when that was uploaded. I won't go through all the list of the other provider documents that are there. They're pretty self-explanatory. You probably are well across what they all are, and we'll show them in the demo. The other one to point out is in relation to those provider documents is that they can only be uploaded by registered healthcare providers working in a registered healthcare organisation for the system. And once they are uploaded, they can't be edited or altered. So a patient can't log into their own My Health record and edit or change or give themselves a new diagnosis in the document that's been uploaded by a healthcare provider. So you can be confident that the information in there that's been provided by another healthcare professional that you can rely on. The consumer documents are ones that the patient can upload themselves. They can log into their own My Health record and add information if they wish. That's particularly relevant if people have significant allergies. They can make sure that's recorded in there. They can also upload a copy of an advanced care plan if they have one, or the person who holds a copy of that advanced care plan, so the custodian. Emergency contacts and so on, they can add as well. Medicare documents do flow into My Health record as well, so you can look up MBS item numbers, PBS claims, organ donor status, and the Australian Immunisation Register. And the other thing to point out is just these overview documents that are listed in the centre here in these circles. So these are documents that are actually generated and have been developed by those at the agency who try to make this work better for you as clinicians and make the information quick and easy for you to find. So these overviews consolidate the information that's held across a person's My Health record and bring it onto one screen so you can quickly and easily find what you're looking for. So for instance, with the medicines information view, you can imagine that quite a number of the documents listed on the right-hand side could potentially include medicines information. That's all on one screen through that medicines information view. And likewise, there's a new enhanced view of immunisations that you can find, that immunisations view, and that gives you a quick snapshot of a person's immunisation status, including COVID-19 status. So I'll jump out of my slides and I'll see if David is off mute, and we'll jump into my demonstration sandpit environment. I should point out that this is a fictitious patient. His name's Caleb Darrington. He's one of our regulars. We have a sandpit clinical software environment where you can have a play and not actually mess up someone's My Health record. So that's what I'm using tonight. So all the data in here is totally fictitious. Don't take too much notice of the nitty-gritty detail. It's more showing you what you can find and how it might be useful for you. So David, just to kick things off, does this setup of Jeannie look familiar to you?
It does. It's the same software system I use in my office.
And do you see this little My Health Record tab and button in your system at the moment?
Yes, I do.
Yep, great. So if you can see that, that means you have access to patient's My Health Record. And just in relation to that, you have authority to view their My Health Record as long as you're providing care to that person. So if you click on that tab, you land on this document list page. The slightly confusing thing can be that it looks like it's empty, but that's because these filters need to be applied and you need to think about how you want to view the information. So you can select to just view the last 3 months worth of information, because if you think about someone who's been in and out of the healthcare system a lot, they might have a lot of information in there, or you can set a specific date range. So for tonight, I'm just going to put it as a date range for 2000, and just because I know we need some further back information, I'll go till tomorrow. And then we just need to click View Document List to update that list. And that will bring in all of the documents that are falling within that date range. So it just takes a little while, and because mine's a virtual system, it takes a little bit longer. While that's happening, David, can I ask you, what are some of the key things that you as a surgeon would really like to be able to see, given what I've shown you on the slide before in terms of what sort of documents are available? What sort of thing would be particularly of interest to you?
So if a patient came to me and I'm assessing them, the things that would be most relevant to me as an orthopedic surgeon would be I'd want to know what x-rays they've had in recent times, maybe some basic blood results, and maybe any recent operative reports if they happen to be there, or I suppose it may be relevant any previous letters from other specialists or general practitioners.
Yep, great. So I'm just checking in here, and my demo version seems to not have what I'm specifically wanting to show you, which is annoying. But you can see down here that there are diagnostic imaging reports listed in here. So you can just click on the report that you're interested in and double click on it. But there should be a diagnostic imaging overview, and I am just not seeing it at the top of my screen. You can see that they're generated based on today's date. Maybe it's because this patient hasn't had very many diagnostic imaging reports done, but let's just double click on that imaging report that's there. And if we double click, it should just open up. It takes a little while. Most of the imaging reports are uploaded, they can be contained as a locked PDF. So you can see that there's the report description. So you can click on any blue hyperlinks to get to the information. And sometimes they do actually include a copy of the image as well. Oh, that one doesn't have a full image, but it's just got a test version. Sorry, as I said, this is all fictitious information for this patient. Let's try the report description and see if we get anything there. Diagnostic imaging report. That would be a PDF from the actual diagnostic imaging of the actual report there. And you'd just be able to download that and save a copy in your local system. Sorry, that's not a particularly great example of that. Let me jump out of this one and go into the pathology overview, just to give you an idea. So if they have had a range of tests done, I'm just loading up the pathology overview. As I said, they will become consolidated into these overview reports. And just as an example to show you from the pathology report, you can see we've got a range of different tests, and they're initially grouped by test name and specimen collection date. So you can look down here and say, okay, I want to see the full blood count. Was that what you said before, David?
Well, that may be one of the. I'll give you an example. Is sometime if I'm working a patient up for a joint replacement, and they happen to say, "Oh, my GP organised some bloods that I had only 3 weeks ago." Rather than me repeating the blood test, I might say, "Well, it'd be good to have those results." So if they've had a recent full blood count, that might be valuable and avoid the patient having to have that test repeated.
That's exactly the benefit of having it in here. So then you can just click on that report that they've said that they've just had. And again, it's just a fictitious report, but that would be the report and you'd have the full results there. And as you say, it's that benefit of having that report without having to re-request. So you are able to, as long as the labs are connected, you're able to access any report that's been uploaded for the patient, regardless of whether you requested that initially or not. So you can see anything that's been requested by any other healthcare provider for that person. And as you said, if they've had a blood test just 3 weeks ago, you'll find it in here. So it's uploaded immediately. As soon as that report's finalised, it's sent to the requester as per usual and uploaded at the same time to My Health Record, and then immediately available to you as healthcare providers to be able to see it. Patients can log into their own My Health Record and look at their information, but there is a 7-day delay before they can view those reports, and that's so that the requester has time to contact them if need be and have the conversation with them about that report. So David, did you also mention an interest in seeing medications?
Well, for me personally, it's not as relevant, but there are situations where it'd be valuable to know, for example, if they're on an anticoagulant like warfarin or Eliquis or one of those platelet-derived medications would be valuable.
Yep. So as I mentioned, this is another one of those overview documents. Once my screen loads, it's just going very slowly, sorry. Another one of those system generated overview documents, and it appears and it brings together any medicines information from across the person's My Health Record. The first section that always appears is this allergies and adverse reactions section highlighted in pink. This is sort of like a navigation panel across the top here, so you can just click onto any of those. So the allergies and adverse reactions are listed first, and then medicines. So if we click on the medicines preview, you can get a quick overview of what they have had from the different source documents. So the nice thing about this is that it's sorted by date order here, but you can sort by active ingredient. You get the dose and directions, and you also get a hyperlink through to the source document. So if you want to find out more, you can look at that as well. So that would be one way to see whether that patient was taking any anticoagulants, that sort of thing. The other document that's really useful in terms of this view, it's quite handy because it gives you a quick link through to that shared health summary that would have come through from the GP. Sorry, excuse my dogs barking in the background. So in this instance, Caleb has had a shared health summary uploaded by his GP. It was done some time ago, so you'd need to take that into account, but it may give you some useful information that you might not have otherwise had. So you can see here, this summary includes the adverse reactions, medications, medical history, and so on. So that could be a useful starting point as well. The other hyperlink that was in that medicines overview was straight to the discharge summary. So if someone's been in a hospital recently, you can see the discharge summary and get a quick picture of that as well. You mentioned operative reports, David. Those are not yet flowing into My Health Record. So it's dependent on the healthcare organisations in terms of what documents they're currently uploading. Most hospitals at this stage, it is primarily just discharge summaries. Some hospitals are starting to contribute goals of care documents, and others are also doing specialist outpatient clinic letters. So you will see more and more of those coming through into the system. And software developers are adjusting their software to enable the uploading of specialist letters as well. So that's coming soon across a lot of different softwares. I've got some updates about that further on in my slides. But that's when you'll start to see more of those software documents available as well. Sorry, specialist letters available. The other one briefly to mention, I think particularly pertinent at the moment, is the immunisation consolidated view. may not be directly relevant for you as surgeons. I'm not sure how much you want to know if someone has had their COVID-19 vaccinations, but I guess if you're about to do surgery, that would be something you may want to know. And you can see here we've got this consolidated immunisation view, links to the Australian Immunisation Register. So at the moment, it's now mandatory for any COVID-19 vaccination to be reported through the register. There is another tab here which shows you any immunisations that have come from other sources across the person's My Health record. And you can see here there's actually a status bar which tells you that this person has actually received all of their COVID-19 vaccines, and you can see the details underneath. So you can see that they've had the AstraZeneca 1 and 2. So that can be quite handy as well. Any other documents, David, that...
Look, from my point of view, that would be most of what I would be interested in. However, you know, different specialties have different requirements. So you did mention bloods, but things like histology reports, if a doctor's looking up a cancer result, for example, which
Yep.
I don't deal with much.
That certainly will be there in that pathology overview. You'd find those in there. Yep.
And I personally can't think of that would be the main things that I think surgeons would be interested in, to be honest.
Yep. And I think, I mean, I hope that that has piqued your interest in looking at people's My Health record a bit more in terms of just being able to find perhaps 1 or 2 diagnostic imaging reports that you haven't directly received, or a pathology report that you haven't directly requested, and not having to reorder those bloods, like you said. I think just in that, you know, it can be just those little things that can make a big difference to the care and reduce the need for duplicate tests as well.
I will note one thing. I see at the bottom there's an e-referral, a second from the bottom.
Yep. There's not a lot of those flowing into the system yet. As I said, this is all fictitious data in here, but some softwares are working towards being able to have those contributed as well. Does that answer that?
It does. It does.
Yeah, great. So I'll just, if anyone has any questions or would like to see anything further, and then I'm happy to go back there later on. But I guess just to highlight some of the key benefits for you as specialists, it's really about having quick and easy access to key health information that you may not have directly received. Reducing time spent chasing information, and as David mentioned at the beginning, I've been doing a lot of work with Aboriginal Medical Services. They have a lot of patients who move around a lot, travel to different places, perhaps not so much at the moment, but usually, and just the time spent tracking down information can take so long. Some of them don't get the discharge summary sent to them, and it can take 3 weeks for them to track them down. So to be able to see them through My Health record is a real bonus for them, and I'm sure you will find some things that are a real bonus for you as well. Once your software is able to send specialist letters, the benefit for you, of course, is it saves you time and your business time in terms of having to resend letters to any other healthcare professionals that contact you and want a copy. And of course, having access to that key health information means it will hopefully support improved clinical decision making in your practice, having that access to specific information, and as we've highlighted in the demonstration, avoiding that duplication of tests unnecessarily. So there's a couple of different things to be aware of in terms of how you can actually utilise the system. If you're working in the hospitals, either public or private, then you can view My Health records through a range of the hospital applications, or through, if you have software, or the National Provider Portal. Most hospitals, as I mentioned at the beginning, are actually now getting connected to the system, which means you can view it through the hospital application and you don't have to go through any registration process. You just need to find out which button to click in the application, and you'll be in and you'll be able to view the information. As I said, for patients themselves, they can log into My Health record themselves through the MyGov portal and view the information that's in there, and they can also upload in that way. In terms of uploading for you in hospitals, it's really done at the hospital level. So those discharge summaries, as I said, are now being defaulted to send unless a person specifically requests that they don't want it to go. This just gives a bit of an overview of the different states and territories and how they're using the system in the jurisdictions in the public hospitals. So you can see here the different ways that they're being utilised. Quite a few are using a middleware which is called HIPS, which gives you a really nice view of the system, and you can quickly and easily find the information that you need. I should mention these slides will all be sent, they're available. Virginia will send out a copy after the session as well. So the key message is, if you're in the hospital setting, find out how to access and view it. Might be worth also checking whether the hospital has a local policy and what the policy is, but generally it's there to be used. It's there to support your clinical care. Check with your health information manager or your local intranet and find out how you use it. It's also probably worth finding out which sort of documents are being uploaded from your hospital. As I said, most are doing discharge summaries now, so just be conscious if you're contributing to those discharge summaries, that information will be in there. Goals of patient care, as I mentioned, and those outpatient letters. In terms of private practice, it's a little bit more complicated in that I said that the software systems have to become conformant to be able to interact with My Health Record. They have to meet those technical requirements. We do have a list of the softwares that are conformant, and as you've seen through the demo, Genie is one of those. If you don't have software that is conformant, there is the option of viewing the information in a person's My Health Record through what's called the National Provider Portal. So that's an alternative option. It does only give you the option to view. You can't upload information through the portal, but at least you can find those key documents that you might not have otherwise had. The other thing that the agency is doing at the moment is that we've partnered with a range of specialist software vendors to complete integration with the My Health Record system in their clinical software. So the ones that are listed on this page are in the first round of this software industry offer. They're working towards releasing their products imminently within the next few months. Some have already gone live, and there is another round of an offer for the software developers. So there'll be another group of software providers working towards that integration as well. And the great thing with that is that once that's done, it will be really really easy for you to contribute to the system as well, in terms of if you do want to upload your specialist letters. As you complete that letter, there's an option that can be checked or unchecked to say send to My Health Record. So this is some of those products that have already released their software, and the sorts of enhancements that they're building in, which includes giving you those overviews, which I mentioned, the diagnostic imaging overview, document pathology overview, medicines view, and that seamless upload of specialist letters as well as prescriptions information. If you are in private practice, you do need to register your organisation or business to be able to connect and get set up to use My Health Record. Before you do that, you do also need to make sure that you have a My Health Record security and access policy in place for your organisation. And there's a few other things to consider in terms of who's going to have access and be authorised to use the system, making sure your staff have appropriate training and are familiar with the policies, and making sure you're meeting the ongoing participation obligations. So being aware that it's there for the purposes of providing healthcare for patients and using it appropriately, and reporting if there are any data breaches within your system, reporting those appropriately as well. In terms of getting through that registration and connection process. The agency has a specialist connections team that can support you through that. If you want help, you can also just go to the website and find your way through, but you can contact the agency's team and they will guide you through that process. We're also working with the local primary health networks, and a lot of them are able to come out to your practice and guide you through that as well, face to face. And there's a little link there which takes you to PHN locator, so you can find out who your PHN is in your local area. So just quickly around security and patient controls, I've already touched on a number of these things. The one thing to mention is that the agency does have a cyber security centre that monitors the usage of the system and does follow up and audit from time to time. The information is also protected by legislation, and there are significant penalties for deliberate misuse of the system. I guess you should think about it the same as any healthcare information. It is private and confidential and needs to be treated appropriately. I won't go through the rest of the points on this slide because I think I've already covered them in the presentation. Briefly pointing out some of the other controls that individual patients can put on their My Health record. And this can be quite reassuring if you are talking to anyone who does have any concerns about, who can see the information in their My Health record. Patients can choose to put a code over their whole My Health record if they want, or even over specific documents. So if there was something, say a psychologist's report, they could just put a code over that particular document. If they have put those codes in place, there is an option for an emergency break glass that can only be used if it's a legitimate purpose and you can't get the code from the patient themselves, then you can use that. But in most cases, most people haven't put those access controls over their My Health record. They understand that it's there for the purposes of their healthcare, and you can just click on the button as we showed you and get straight into their information. If they have put those codes in place, you'll get a little prompt and be asked to put the access code in. Patients can also choose to get a notification when their My Health record is accessed. So they can get an SMS or an email, and they can also view an audit log of who's used their My Health record and when. And as I said, we have a cybersecurity team that also monitors the use of the system. So if you do use that emergency break glass function, make sure you note down why you used it and ensure that it is for a legitimate purpose, because chances are you'll get a tap on the shoulder saying, why did you do that? Just make sure you can respond appropriately. And in terms of your authority to use the system, it is covered by legislation. As long as I said you're providing care to a patient, then you are authorised to view their My Health record. And as a healthcare provider in a registered organisation, you also have the authority to upload to the system. So the only thing that would stop you from uploading is if the person says that they do not want a particular document uploaded, or if there are certain state or territory laws that require consent to upload sensitive information. Yeah, so I think that's covered that. If you do have questions, please feel free to type them into the question pane, and we'll get to those in a moment. Just pointing out a couple of really useful resources that might be of interest. In particular, we have a digital health specialist toolkit. That covers not just My Health record, but it covers telehealth, secure messaging, and electronic prescriptions. And it has a range of different useful guides and videos and benefits and so on. Those guides in particular I find really useful to be able to take you step by step through the process of what you need to do to get registered, connected, templates, links to templates for policies and so on. We also have e-learning modules that are accredited that you can look at, as well as demonstration videos and so on. The team that I work with at the Australian Digital Health Agency is also running virtual classroom sessions. So we cover off what you can see in My Health Record and how you can use it across a range of different software systems. So if you use one of these other systems, feel free to jump onto one of these classroom sessions. We also do a demo of the National Provider Portal. And we are also running hospital sessions, new hospital sessions. So if you have a look on our events and webinars page, you can find the links to those and register to attend. And I will pause there and throw back to David and see if we have any questions.
Thank you, Kathy. That was very informative. I don't think we've got any questions at the moment, so I will start with a question. Is some doctors see a lot of military personnel who are treated through the public and private health system, but not within the military itself. How is there? The military often has extra concerns about security for its staff and personnel. Are there information included in this record system?
That's a good question, and one that I might need to take on notice, actually. I think we do have some specific information around the use of My Health Record for defence personnel, but I am not completely across that. And I know that there are rules in terms of not using My Health Record for employment purposes. But yes, I'm sure that there would be other restrictions in place around defence as well.
Okay.
While we're talking about those sort of questions and those sort of specific details, the My Health Record website has a lot of information around those sorts of things. So that's one place where you might find the answer to that question in particular. I'll try and find an answer for you, David, and send it through. But that web page, if you have any other sort of queries like that, is certainly a useful resource to go to.
Okay. Well, it looks like I can't see any other questions in the chat. At the risk of hogging the questions, I'll ask another one. You mentioned that there are serious penalties for looking up records that you shouldn't be looking up. Can you detail what those penalties are?
Again, you've caught me on the hop in terms of the actual amounts. They would be listed on the My Health Record webpage. They have changed, but I think there are penalties at the individual provider level and or organisation levels, which is why if you are in private practice, you need to make sure you have your policies in place and staff appropriately trained in the use of the system. It's like any other medical record. You shouldn't be jumping in and looking at someone who you're not providing care to. And if you get caught out doing that, then there are penalties that apply.
Okay. Well, I can't think of any other questions to ask, and it looks like we've got about 23 to 25 participants, but I'm not sure anyone else has got any questions. So I might, oh, hang on. No, we've got some questions here. Okay. Rebecca, one is asking, oh, we'll have to come back to that. There's a question here about whether a tutorial on use and access for this system could be provided at the Royal Australian College of Surgeons meeting next year, given that this is relatively new. All right, now the questions are coming.
Sometimes it just takes one.
Yeah.
I'm sure we could arrange to have one of our team members provide that tutorial. We're also, as I mentioned, running those virtual classroom sessions, which show in the specific different software, which is quite handy. It's usually best way to learn it. We also have simulation version of the hospital system, that middleware that I mentioned that a lot of the hospitals are using called HIPS. So we could run a tutorial in that as well. So certainly open to doing that.
Yep. There was a question here. The example you gave tonight was mainly through Genie, using that system, but could, I mean, I suppose what the question is really asking is how different is it between, say, Genie and Clinic to Cloud and ZMed and those other systems that you've listed there? Are they all simply clicking on that icon? Do all those systems have a similar looking icon that you click in order to access the My Health record?
It does vary from software to software in terms of the look and how it's presented, and each one's slightly different. But generally, yes, there is a button or a tab, which is either that little icon or it actually says My Health Record, and it's just a matter of clicking on that and you're in. So it's pretty straightforward. As I said, those virtual classroom sessions are really great for showing you how to do it in each of the different softwares. So if you're using one of those other ones, then you can certainly jump onto one of those sessions and see hands-on how it's done. But yeah, generally there's just a little button and you're in.
There's another interesting question here. Some patients may at various times opt in or out of the My Health record. What happens to the patient's information? Obviously, so let's say someone opted into My Health record for 2021, but in 2020 and 2022 they weren't in it. Do the doctors only have access to that patient's records for 2021 and of 2021 dates, or do they have?
So if a person, if I say I've got my Health record in existence now, if I decided tomorrow to say I don't want to have a My Health record anymore, I would need to cancel it. And once it's cancelled, it's completely deleted. So it doesn't exist anymore. So you would not be able to find any information for me from then on. But if I decided to opt back in and say, actually, now I do want to have one, then it would start afresh. So it wouldn't bring in my data from previously. It would start as an empty folder again and build up over time again. Some of the information from Medicare does come in retrospectively. So the last, say, 2 years worth of Medicare claims may be visible. The Australian Immunisation Register goes back as far as you've got information in it for, but otherwise it would just start afresh.
Okay.
Interesting point on that, David, in terms of the growth of the system is that I think there were quite a few people who initially, when we went through that phase where people could say whether they didn't want to have one, quite a few people opted out. But now the numbers have been continuing to go up. So people are now opting in. So I think they've been sitting on the fence, perhaps waiting to see how it goes, reassuring themselves, thinking about whether or not to have one, and are now deciding, yes, okay, I do want to have one of these. And so the number is actually on the increase and people opting in. So that's encouraging.
Okay. There's a few more questions here. Someone has asked, and I think I'll clarify what they're trying to ask here is, do you specifically have to ask permission to access their record? So a patient that hasn't provided a code, is the permission provided? Where's the permission?
The permission is provided in the legislation. So when we went through that process of switching across for it to being that everyone will have one created unless they opt out, there was specific legislation passed to cover that authority so that you as a healthcare provider can view it. So you do not have to actually, ask the patient, and you can actually look at their My Health record if they're not in the room with you. If they're coming in and you're preparing for that consultation, you can look at it before they're even in the room. As you said, as long as they haven't put those codes in place. If they put those codes in place, you'd have to wait and ask them for the code.
So Joe Bloggs comes in to my office and they've got a year's worth of My Health records or something similar. But it's the first time I've seen them. How does, I don't necessarily have to ask permission when they arrive in the office. It's assumed, given that the legislation has said that and the patient has opted into the system.
Yep, exactly. You have that authority under the legislation. Yep.
Sorry, go on.
No, that's fine.
Oh, sorry, I thought you had to say something. Someone is asking here, would you be able to share contact details about the conference next year? Is that possible? The RACS conference next year, in terms of providing ongoing education about this system for surgeons at a bigger venue?
Sure. So you can either contact, if you send an email to the email address that's on the screen, help@digitalhealth.gov.au, and indicate that you want educational training for that as a tutorial for that conference. They will direct it to the appropriate team. It'll probably come through to my team. So yeah, that'll come through that way. If you do want to contact me directly, you can do that as well. My email address is just kathy.rainbird@digitalhealth.gov.au.
Rebecca, you asked that. Does that help answer your question? Just maybe in the chat, say, give me a thumbs up or something if that's happy. I think that's the end of the questions that have been answered that I'm hoping I've been able to answer for everyone's behalf. And we might wrap that up at this point. And so, Kathy, I'd very much like to thank you for your time and your informative presentation. And to everyone else, this webinar will be has been recorded and will be on the college website for reference later on if you wish to look at it again. So I will wrap that up and thank you everyone for your time.
Thank you. Good night.